Every blood pressure medication can cause some side effects, that's true for all of them. But what many people don't realize is that some types of blood pressure drugs are much more likely to cause side effects than others. These can range from mild issues like fatigue or dizziness, to more serious complications that affect your heart, kidneys, or electrolyte balance. In this video, let's go through the main classes of blood pressure medications and talk about which ones are generally considered the safest, meaning they tend to work well while having the fewest side effects. What I'll explain here applies mainly to people who only have high blood pressure and no other major medical conditions, such as diabetes, heart failure, or kidney disease. If your specialist, like a cardiologist or endocrinologist, prescribed a specific medication, that's likely because you have another condition that makes that choice appropriate. So please remember, what we're talking about today doesn't apply to everyone. You should never stop or change your medication on your own. But if you're curious about why your doctor chose a certain drug for you, it's absolutely okay to ask. Sometimes there are safer alternatives worth discussing. Now, let's look at each major class of blood pressure medications, starting with the ones that are not usually recommended as a first choice for new patients. 1. Central alpha agonists. These drugs work in your brain to lower blood pressure by reducing the nerve signals that tighten your blood vessels. The most well-known medication in this group is clonidine. Clonidine is powerful, but it often causes fatigue, dry mouth, and drowsiness. More importantly, if it stopped suddenly, your blood pressure can rebound dangerously high. For this reason, clonidine is rarely used as a first treatment for high blood pressure. If you're taking it only for hypertension, it's worth discussing with your healthcare provider whether another option might be safer for long-term use. The way these side effects occur is directly related to how the drug works. Central alpha agonists act on the brainstem, especially in an area called the medulla oblongata, which controls sympathetic nerve activity, the part of the nervous system that keeps blood vessels tight and alert. By stimulating alpha-2 adrenergic receptors, they reduce these tightening signals, which lowers blood pressure. However, this also slows brain and body activity, leading to fatigue, drowsiness, or even mild depression. The reduced nerve signals also decrease saliva production, causing dry mouth. Over time, the body adapts to the constant drug effect, so stopping clonidine abruptly triggers a strong rebound of sympathetic activity, and a sudden, dangerous rise in blood pressure. 2. Alpha blockers. Common examples include terazosin and doxazosin. These drugs relax your blood vessels by blocking alpha receptors. While they can lower blood pressure, they often cause dizziness, fainting, especially when standing up, or swelling in the legs. Because of these side effects, they're usually prescribed for people who also have prostate enlargement, not just high blood pressure. For most people, they shouldn't be the first choice. To understand their side effects, it helps to know their mechanism. Alpha blockers act on alpha-1 adrenergic receptors located on the walls of blood vessels. When these receptors are blocked, the vessels relax and widen, improving blood flow but also lowering pressure too suddenly for some people's systems, particularly older adults. When you stand up quickly, your body needs to tighten blood vessels to prevent a sudden drop in blood pressure. Alpha blockers interfere with this response, which can lead to orthostatic hypotension, dizziness or fainting when changing position. Additionally, relaxed blood vessels may allow fluid to pool in the lower legs, causing swelling. Some patients may also experience palpitations or mild headaches as the body tries to compensate by increasing heart rate. 3. Loop diuretics. The classic examples here are furosemide, Lasix, and bumetanide. They lower blood pressure by helping your kidneys remove extra salt and water, which reduces the volume of fluid in your blood vessels. However, they can disturb important electrolytes like potassium and sodium, and cause dehydration or cramps. These drugs are mainly used for people who have heart failure or swelling in the legs, not for someone newly diagnosed with high blood pressure. The side effects of loop diuretics are closely tied to how they act inside the kidneys. These drugs work in a specific part of the nephron called the loop of Henle, where they block the reabsorption of sodium, chloride, and potassium. This causes a large amount of salt and water to be flushed out in the urine, which lowers blood volume and pressure. But when too much salt and water are lost, the balance of electrolytes in your body shifts. Low potassium, or hypokalemia, can cause muscle cramps, weakness, and even irregular heartbeats. Excessive fluid loss can also make you feel lightheaded or dehydrated, and may strain the kidneys, especially in older adults or those taking multiple medications. In short, while all these medications can reduce blood pressure, they carry a higher risk of side effects and are rarely the first choice for new patients. The goal is to lower your blood pressure safely, effectively, and in a way that helps you feel better, not worse. The safest medication is always the one that fits both your body and your overall health profile. 4. Beta blockers. Another class of medications sometimes used to treat high blood pressure is the beta blocker group. The most common examples are atenolol, metoprolol, and nadolol. These drugs work by blocking the beta-adrenergic receptors in your heart and blood vessels. By doing so, they slow down your heart rate, reduce the force of contraction, and lower the amount of oxygen your heart needs. This helps to decrease blood pressure and can protect the heart after a heart attack or in patients with certain heart rhythm problems. However, beta blockers are no longer considered the first choice for people who only have high blood pressure and no other heart disease. Their side effects are closely tied to how they work. When beta receptors are blocked, your heart rate may drop too low, which can cause fatigue, dizziness, or even feelings of depression due to reduced circulation and energy. They also affect metabolism by decreasing insulin sensitivity and slowing how your body uses glucose, which can raise blood sugar levels, a concern especially for older adults or those at risk for diabetes. Some studies also show that long-term use can reduce testosterone levels slightly, leading to lower energy or libido in men. For these reasons, unless your cardiologist specifically prescribed one for a heart-related reason, it's a good idea to ask your healthcare provider why you're on a beta blocker instead of a safer first-line medication. 5. Calcium channel blockers, CCBs. The next drug class, somewhat safer but still not ideal as your very first blood pressure medication, is the calcium channel blockers. Common examples include amlodipine, diltiazem, and verapamil. These drugs lower blood pressure by preventing calcium from entering the muscle cells of your heart and blood vessels. Without calcium, the muscles can't contract as strongly, so the arteries relax and blood flows more easily, leading to lower pressure. The side effects of CCBs occur because calcium plays a vital role in muscle and nerve function throughout the body. When these channels are partially blocked, the small arteries in your legs may widen and leak fluid, causing ankle or leg swelling, edema, one of the most common complaints. The slowing effect on the heart can also lead to bradycardia, slow heart rate, or, in some people, heart rhythm disturbances. Some patients experience headaches, flushing, or constipation, especially with verapamil, because smooth muscle tone in the gut and blood vessels is reduced. Although calcium channel blockers can be very helpful in patients with certain heart or circulatory problems, for most adults newly diagnosed with high blood pressure and no other conditions, there are typically safer and better tolerated options available. If you're currently taking a calcium channel blocker or beta blocker as your only medication for blood pressure, and you don't have any other major medical issues, it's a good idea to have a conversation with your healthcare provider. Ask them why that specific drug was chosen and whether a switch to a safer, first-line medication might be right for you. 6. Thiazide diuretics. The next class of blood pressure medications is the thiazide diuretics. The most common examples include hydrochlorothiazide, chlorothiazide, and chlorthalidone. These medications work by helping your kidneys remove extra salt and water from your bloodstream, which reduces the total fluid volume in your body and lowers blood pressure. They're often used as a second-line therapy or sometimes combined with other medications to improve blood pressure control. The main concern with thiazide diuretics is their effect on electrolytes and metabolism. By promoting sodium and water loss, they also increase the loss of potassium and magnesium, leading to fatigue, muscle weakness, or irregular heartbeat if not monitored. They also reduce how well your body handles insulin, which can cause higher blood sugar levels, especially in older adults or people at risk for diabetes. Additionally, they may increase uric acid levels, which can worsen gout in some patients. Because of these effects, thiazides are helpful for many people but not ideal as the very first drug for someone newly diagnosed with high blood pressure, unless there's a specific reason your doctor recommends them. 7. ACE inhibitors, angiotensin-converting enzyme inhibitors. Now let's talk about one of the safest and most effective categories of blood pressure medications, the ACE inhibitors. Examples include benazepril, lisinopril, and quinapril. If your medication ends with pril, it's part of this group. These drugs lower blood pressure by blocking an enzyme in your body that converts angiotensin I into angiotensin II, a powerful chemical that tightens blood vessels. With less angiotensin II around, your blood vessels stay more relaxed, which lowers blood pressure and reduces strain on your heart and kidneys. ACE inhibitors are generally very safe, inexpensive, and well tolerated. The most common side effect is a dry, persistent cough, which happens because the same enzyme that affects blood pressure also breaks down a substance called bradykinin. When bradykinin builds up, it irritates the airway, causing that tickling cough in some people. Rarely, ACE inhibitors can cause swelling under the skin, angioedema, usually in the lips or face, which can be serious. Despite that, for most people, ACE inhibitors are one of the best first-line treatments, especially for those who also have diabetes or early kidney disease. If your doctor started you on one, it usually means they're following the most current and evidence-based guidelines. 8. ARBs, angiotensin II receptor blockers. Finally, we come to what many doctors consider the safest overall class of blood pressure medications, the ARBs, or angiotensin II receptor blockers. Common drugs include losartan, valsartan, and candesartan. Like ACE inhibitors, ARBs target the same hormone system that controls blood vessel tightening, but instead of blocking the enzyme that creates angiotensin II, ARBs block its receptor, the spot where the hormone attaches and exerts its effect. This results in the same blood vessel relaxation and blood pressure reduction, but usually with fewer side effects. Because ARBs don't interfere with bradykinin, they rarely cause cough or swelling. They're also metabolically neutral, meaning they don't raise blood sugar or affect hormone levels. For many people, ARBs strike the perfect balance between effectiveness and tolerability, making them the top choice for long-term blood pressure management. They're available in generic versions that are both affordable and well-studied, with a strong safety record in large clinical trials. If you've managed your diet and lifestyle carefully, for instance, following a low-carbohydrate, low-processed oil diet, but still need one medication to keep your blood pressure in a healthy range, an ACE inhibitor or ARB is often the right place to start. On the other hand, if you're concerned about your testosterone levels, avoid beta blockers. If you're worried about blood sugar or gout, avoid thiazide diuretics and beta blockers. And as we discussed earlier, the other older classes, like central alpha agonists, alpha blockers, and loop diuretics, tend to carry more side effects and are rarely the right first choice unless there's a specific medical reason. Most importantly, never stop or change any medication on your own. Always speak with your healthcare provider first. The right medication, in the right dose, for the right person, can protect your heart, brain, and kidneys for years to come. Remember, it's never too late to take control of your health. You don't have to do everything at once, even a single change, like cutting back on salt, walking for 20 minutes a day, or staying consistent with your treatment, can make a powerful difference. So keep learning, keep asking questions, and never lose faith in your power to improve. See you in the next video.